We have talked about the infection mood and how to protect the health workers and how to protect the society from being infected by this new virus. And also we have talked yesterday about the about the mood of these infections and the background of the virology, whether it is God-made or it is a human-made. And we have almost over 100 questions received, and we answered most of these questions. Today, inshallah, we will continue our discussion about this update of the COVID-19. And we have two eminent consultants, and we will look at the different aspect of this pandemic. And we are going to have the sessions about whether the real after the recovery is going to be reinfections again, and how we can deal with this. This is going to be presented by Dr. Muna Al-Faris, and then we will discuss the anxiety. Definitely, everybody of us has lived this anxiety during this pandemic because the information was not homogeneous, and most of the public were put in a very stressful situation by the bombardment of different informations and from different resources, contradicted informations. This develops an anxiety in the society. And Dr. Saleh Al-Ghamdi, our psychiatric consultant, will address this subject after Dr. Muna. So also, I would like to mention about the CME that we have. These two sessions, yesterday and today, are tentatively approved by the Saudi consular, but they have not given us this because they have changed the mood of the approval. It was before 2 weeks. It takes 2 weeks, but now it will take 1 to 2 days. So be sure that we will get this approval of the CME. So keep please in contact with our administrator, and they will provide you with the CME. Also to mention here about the feedback. After this session, you will receive an email, and we would like to have your feedback about our session, whether positive or negative feedback, because we want to improve. And only with your feedback, the improvement will happen. So again, thank everybody for participations. We have a big numbers of participations, almost over 900. And we can start with Dr. Muna Al-Faris. Dr. Muna is a consultant in internal medicine and consultant in transplant, infection, and oncology at King Abdulaziz University Hospital. She is American board certified in internal medicine from St. John's Hospital. And also she is American board certified in transplant and oncology infection diseases from Johns Hopkins University Hospital. Dr. Muna will talk about reinfections with COVID-19, a very interesting topic. And please, Dr. Muna, start, please.
Okay. Assalamu alaikum wa rahmatullah. We'll start now. Is the screen clear? Today I'm going to talk about after the first, since this is the topic of واضح صوتي ولا لا؟
واضح صوتك، بس حطي يا دكتور على الشو عشان تبقى البرزنتيشن واضحة. أيوة كده. تفضلي.
So we'll start with yesterday they talked about the topics as Dr. Had mentioned, and today we're going to talk what happens after this infection. So for now, there is all over the world, there is more than 3 million people in this pandemic, And the death rates are not that high in comparison to the recovery rate, which are promising. So this gives us an idea that the outcome, inshallah, is good. So, according to the CDC, that the immune response to the COVID-19 is not yet understood. Everyone is basically focusing now on the treatment and on getting the vaccines out in the market once it's ready. So let's talk a little bit about clinical symptoms, which are the common that everyone hears about it. But as the cases start to increase all over the world, we're starting to see a new cases or a new presentation, such as stroke in young people, headaches, loss of taste and smell, which is concerning about some neuritis. And some people are questioning, are those symptoms are recovered or are they permanent? So there is a lot of things that's coming up nowadays. So if you look at the early stages of the disease and the severe stages, you can see that in the non-severe, the body itself has some protection from the immune system with the interferon and some of the host immune system, the T cells and all that. As the disease gets more severe, you start seeing more cytokine storms and monocytes. So those are the things that makes the disease more, because you start breaking everything. This is basically in the lungs, okay? So let's talk about, in general, how immune system develops and respond to viruses. So let's talk, because since we know the influenza for years now, we know how the immune system respond to it. So we can understand if there is a reinfection after being exposed the first time or no. So here we can see once the person is exposed, the viral load will reach the peak. Then after that, you start to see the host respond. Then you're starting to have the antibodies antigen complex forming around, like, let's say 3 months or so after the infections per day. How long does it last? It's different from virus to virus. For example, if we talked about MERS-CoV, the Middle East coronavirus, which is one of the subtypes of the corona family, the estimated time of immunity is around 4 years that the person can be protected. For influenza, it changes year by year because of the change in the structure. So we don't know yet if this new COVID-19 virus is going to change the surface, and the immune response is going to be that long, or it's going to be in a shorter period. Is it going to last like the MERS for 4 years, or only it's going to last less than a year, like influenza, for example? So some of the people, the prospect of people being reinfected is very internationally concerning, and everyone is hoping to start implementing or knowing at least if they're immune, if they got that infection or not. So the test that's going on now, which is the gold standard, it's the real-time PCR, which is a nasopharyngeal swab that's obtained, and it counts the virus, the viable viruses in that host, in that person. Let's say I'm infected. You take the swab, it's going to count how many viruses viable are there. Okay, so after that, how they declare that this person is clear from that infection, 3-4 days after his recovery or no more symptoms that he has, they will swap him again, and most likely that they're going to show that there is no more viruses there, because the viable live virus is gone. So what will last only will be only the dead bodies from those viruses. So that's an idea, because some of the people will have persistently more than the 14 days that we hear about, that it's only 14 days, or that some people will last up to 3, 4, 5 weeks, and we've been seeing it here that they're positive, but they're not infectious because those are the dead viruses, but the body continue to shed it. We call it a viral shedding process. So what's the limitation now? Nowadays, this is the PCR. Now we're going to talk about the antigen antibody complex. The problem with this tests that's coming nowadays, which are the rapid tests that comes like a point of care immediately, most of them are qualitative. They're not quantitative. So it doesn't tell you really how many IgM do you have, how many IgG do you have. When you start an immune response, usually you have IgM for a certain period. It's different from person to person. And then you're going to have the IgG that will last for you, whatever your body is going to respond. So, like for example, let's say our childhood infections like chickenpox will last lifelong unless something happened that will wear off that immunity. So, that test, which is we're talking about now, the rapid antigen test, it's qualitative. So it doesn't tell you really, even if you have antibodies, the quantity of it, is it enough to protect you from getting reinfection or no? So the a more precise way is to do the antibody titer by the ELISA assay, which counting the titer of your IgM and the titer of your IgG to say that you're immune. And then there's another warning that came by the World Health Organization, that there is no evidence that the people who test positive on those tests that's now on the market are protected from reinfection. Why is that? Because there is no enough studies done on those kits, but they emphasize doing that in a research setting to know if those people are really immune or no. So nowadays we can see certain global companies are requesting a certificate that the person, if he got before returning to work, to start getting doing the test, which is to see if he's immune or no. If he's immune, then he's okay to go back to work. So WHO released this statement that there is no evidence that people who test positive for this test are immunized and protected. So it shouldn't be used as a certificate. So those, as I mentioned again, those tests, we have, why is the concern from the WHO? Because there is a six coronaviruses that we know that cause the human infections. Four of them are the common colds that you get every year. You can get twice a year, you can get three times a year. So you're immune to that, wears off. And then we have the MERS and the SARS, which is the first severe adult respiratory syndrome. The MERS, as I mentioned, it can last up to 4 years, and the SARS can last up to a year or so. So we don't know if this new COVID is gonna last the same as the SARS or no, because sometimes there could be antibody antigen interactions in the test. So you can be positive for this new rapid test, but maybe positive for the MERS-CoV and there is a cross reaction. Maybe you're positive for the SARS, so you have a cross reaction. So it's not clear. It has to be tested and known that it's only dedicated to this specific virus, as they came up with the MERS immune kit. So how long the immunity to COVID lasts? It's hard to say again, but from the other coronaviruses I mentioned, between 1 to 4 years, and some people are estimating to be like around 4 years, because that's depend on the specific T lymphocytes in your system. And some people are different than others. Some people can form very good immune system and good antibodies early on the disease, which can be protective and last longer. And some people have the tendency to have a shorter or any event that can cause wearing off of that immune system. So there was another study that's done that counted those point of care tests, and they did the IgM and IgG with the ELISA, and it was sensitive and very specific, the IgM for the SARS-CoV, which is promising. And there was another one done that showed like also the IgG is also very specific. So both antibodies were performed well, and the serodiagnosis for this COVID, well, it was very good in specificity, which what we need because we're not screening people at this time. We just want to know their immune status. So if we look at here, when do usually they start forming? This study was done on a small number of people. They didn't it was around a sample of more than 300. So in the first 1 to 7 days, we can see that the IgG, only one person started to develop IgG, and only 3 out of 27 started to develop IgM. And then if we can see after 15 days, 30 out of the 31 started to have IgG, which is very good, uh, uh, promising thing. And then here we're talking about the sensitivity and the detection of the viral with the real-time PCR. We know that usually in the first days it's very low, but as the virus goes on, it will be more, the viral load is high. So there is another study also done to talk about or to try to understand this immune system, that they did a study on 6 pregnant women after they developed by a C-section to see if the babies have, the infant has already antibodies in all those newborn. So they found that the neonatals, they did for them throat swab and blood tests, they were negative for the virus, and they didn't have any antibodies in there. So there was no fetal to maternal transmission so far, or some of the limitation of the study that the placenta was damaged during the C-section. So they did this as a point of care with the detection of high levels of this antibody antigen complex. Uh, One more thing is, those are certain cases that was published over the media about some people that some of the scientists didn't know how to differentiate it or to understand. This patient was in Canada, and she had the COVID infection, and then after complete resolution after 10 days, according to them, it was by nasal PCR, so she was negative. So she was cleared, and then after 10 days, her house members started to be sick again, and she infected the majority of them. Then she started to get symptoms again back. So at that time, they were thinking, is this patient having another reinfection, or it was only like relapse or false positive test from the beginning, the negative that she got in the middle? Maybe she had a negative and she went into like a surge of immune system that's fighting the infection at that time, and then when her immune system got weakened again, her symptoms showed again. Or maybe from the beginning it was another corona virus, one of them, of the common cold, and the symptoms were mimicking because she had fever, cough, and sore throat. She didn't have any complicated symptoms or any advanced symptoms. And there was announcement done by South Korea that there is a reported cases of recurrence in patient that they thought that they recovered from the COVID, but it's not sure if it is, as I mentioned, because of the shedding of the virus, and it's not a viable a virus by itself. So this is again the statement that I emphasize on by the World Health Organization, that we can't use those point of care tests now to say that the person is immune because it's not tested enough, and it's highly encouraged to be tested on a research basis only. So what's our take home messages? That there is currently no evidence that people who recover from COVID has an and have an antibodies are protected from second infection, and there is also no evidence that someone can get reinfected immediately or at the same this. There is expected, per the epidemiologist, to have another surge of the COVID in 3 or 4 years down the road. So maybe at that time they won't have immunity, and they can have a new active infection, and hopefully by that time vaccines will be out there, and people shouldn't ignore the WHO recommendation, and the expert recommend to stay healthy, stay away, keep a distance, wash your hands, and covering cough and sneeze, as we know, which we keep always saying, and most importantly is the social distance. And thank you very much.
Well said, yeah, Doctora. Thank you very much. You made us more confused than before. But definitely, I am receiving a lot of questions about reinfections, and we keep these questions at the end. I have almost here gathered them in about 6 questions. We will continue, and we will come back to you, Doctor. Thank you very much. Was really informative about the reinfection of the COVID-19. Now, we will proceed to Dr. Saleh Al-Ghamdi. Dr. Saleh is a psychiatry consultant, an assistant professor of psychiatry at the College of Medicine at the Imam Mohammed bin Saud, Jamaat al-Imam Mohammed bin Saud al-Islamiyya. He has a fellowship in psychiatry in McMaster University, and also he has a psychosomatic fellowship, which is a very interesting subject today of the psychosomatic diseases from Queen's University in Canada. Dr. Saleh will give us his talk about a very interesting subject, actually. How we have the society, by this massive of informations, contradictions of informations from the politicians, from the consultants in infection diseases, in epidemiologies and virologists. It develops a massive or real anxiety, including myself, about this COVID-19. Is it something that we can control this anxiety, Doctor? So please, Dr. Saleh, give us your insight about this subject, how the anxiety can be controlled in this era of the pandemic. تفضل يا دكتور. دكتور صالح معانا؟
Presentation, and so I'd like to thank Saudi German hospital groups for
دكتور صالح الصوت
inviting me to present this lecture about anxiety during.
Can we view Dr. Saleh? The voice is also not clear. Anyway, until Dr. Saleh join us again, maybe can ask some question of Dr. Amuna, so you will not get bored waiting for this. Doctor, we have. I still don't see Dr. ولا أسمع صوته. دكتور
السلام عليكم.
عليكم السلام ورحمة الله. ما شايفين دكتور صالح.
I think there is a problem in Allah.
You still have a problem?
I think there is a problem in the internet connection, but I think it is working now. I will try to go. Do you hear me, Dr. Khalid?
I can hear you, but I don't see the presentations. And so most probably the participants can't see it. Aywa, now I can see.
What about now?
Now is good. You can start, please.
Okay. Tonight I'm going to talk about anxiety during COVID-19 pandemic. The question now is coronavirus pandemic harming the mental health? Let's start by this question. And before answering this question, let's see this video clip.
البرزنتيشن ما هي باينة على الشاشة عندنا.
الصورة واضحة دكتور؟
لا أنا شايف صورتك بس البرزنتيشن لو you can Push
let
the
me go back. Okay, let me share, and I try to share it again.
لسه ما طلعت.
لا لسه ما طلعت، لحظة بس أنا أحاول إني أطلعها. أيوه الآن طلعت الآن.
coming. ايوه لو تضغط على ايكون
واضحة؟
شو. ايوه واضحه. شو بليز.
ممتاز.
في عندك الاسفل على اليمين في شو عشان تطلع المحاضره كامله على السكرين.
اوكي just a moment. اوكي واضحة الآن؟
هي واضحه بس احنا نبغى الصوره تكون. ايوه جو هيد ناو واضحه. تفضل يا دكتور تفضل.
ممتاز. The question now is coronavirus pandemic harming the mental health? I said before answering this question, let's have a look to this video clip.
ما هو ماشي الفيديو بس الفيديو مخيف. It's terrifying فيديو. معانا يا دكتور صالح. I will go to the manager of the to reconnect مع الدكتور صالح. دكتورة سمعتني يا دكتورة؟ عبال ما يجي الدكتور صالح نسألك شوية أسئلة بس عشان الوقت. احنا في عندنا الآن we can see there is a dilemma in the vaccinations. يعني we have without going into politics, but what we see even from the professionals or from the public, a dilemma and controversies in the information and in the news about vaccines. Today we hear the vaccine is out. Tomorrow, no, the vaccine will take another year. After tomorrow, we're here, yes, it is. Then we hear vaccination, combined medications between the chloroquine and the other antibiotic generations. Can you explain to us what is really this vaccine dilemma? Why this vaccine dilemma is so? سمعتني يا دكتورة؟ It seems that today we have
اوكي الحين سامعني؟ ما كنت قادرة اسوي unmute. Okay, regarding the vaccines, so usually I know the media does this big dilemma about the vaccine coming up tomorrow, in a week, in a month. Usually, to be like honestly, like scientifically speaking, there is no vaccine before a year. If we don't know yet how the host immune responds so far for this infection, yet understanding how the immune dilemma for this, how are we going to come up with a vaccine that soon?
Yeah.
So I don't expect some of them, they can do already, they started phase 1, but we know there's 4 phases of vaccines, steps to reach the final vaccine to be safe to be used on people. And this dilemma also happened during the MERS COVID when the Middle East syndrome happened. Everyone said the vaccine is coming. And when did the vaccine come? 3-4 years after. So it wasn't that. So I don't expect any vaccine yet to be like even FDA approved before if we said that's it will be very quick, not before 6 months or so. If it's not a year, minimum should be a year.
يعني I can take your statement to deliver to كده أنا
سوبر يعني باور ان هم
اليوم في تويتر I put it on Twitter اليوم. I can say now just to satisfy the public and also the scientists that vaccines is not an easy issue that you can say from today or tomorrow I have the vaccines. So what we hear is only a hearsay and let's say a political between two practice. It's a gags, okay?
Yeah, exactly. Yeah. So every company try to advertise or to say that we have already the vaccine coming soon on the market. Maybe they're testing, and they are definitely testing a lot of kind, but they are still in phase 1. Most likely, I don't think they even reach phase 2 or 3 to be, applicable for human beings yet.
And it must be human safe at least. I mean, it has to be tested on some.
Yeah, and I think they're taking ideas maybe from the virus affecting the animals. So they're taking an idea from those vaccine and trying to test it and modify it to have. There is a lot of dilemma about how are they going to do that, and how frequent is this vaccine going to be administered? Is it going to last for a year, for 2 years? It's different. So.
Okay. Is Dr. Saleh now back, or we can continue with the questions? أنا ماني شايف الدكتور صالح. طيب, let's go another questions. Now, your statement that you have stated that because of the immunity, because you cannot, or there is no scientific evidence that the patients who were infected has developed a significant immunity that they will not be reinfected.
Exactly.
This leads to the next questions. When I should consider myself as cured, if there is no test or this ELISA test, even if it is confirmed that I have some antibodies in my system, but I'm still not 100% protected from another reinfections.
It's very hard to say, but if we talk as the nature of any viral infection, usually at least you'll have a couple of months of immunity that your body usually forms. But they don't want yet, because they don't have enough data or evidence base to tell you, oh, you're immune for like say 3 months, you're immune for 2 months, and then after that you have to worry, because it's really hard, because it's controversy and it's based on the person immune system. So you can't speak for someone who has low immunity or went into chemotherapy, or for example developed another severe pneumonia for any reason, bacterial pneumonia for example, that will weaken his immune system, so he can get infection by any say. But for now, as we know, there is reported cases that someone got reinfected and was confirmed that he was reinfected after he was cured from the initial one.
طيب,
I'm ready, Dr. Khalid.
You are ready? طيب. You can start, then I will continue the questions to Dr. تفضل يا دكتور صالح.
Okay, thank you. طيب. So I'll go back to the video.
الفيديو مرعب يعني خوفتني.
واضح؟
لا لسه ما جاء الفيديو. إذا كان تقدر, we have seen the video part of it. But
Yeah, I will try to skip it. No problem.
Yeah. maybe you jump the video, because sometimes video inside the
Okay, what about the slide? The slide is clear?
Slide is not yet appearing. If you can just
let me go back to share it again. Is it clear now?
Yes, it's coming now. Yes.
Okay. So the part of the video clip that you have seen right now, actually it was in late August 2017. Hurricane Harvey cut through Texas and other southern states. It was actually catastrophic flood, which affects millions of Americans. During that time, they saw a surge in calls and texts for help regarding mental health problem or psychological distress. This surge, it was in September, the month after. Nothing since that time has actually topped that until now, with the highness COVID-19. The Substance Abuse and Mental Health Services Administration answered roughly 7,000 calls and received 19,000 messages in March, a more than eightfold increase from February. As you can see here, in October 2017, it was about 5,000. Since then, nothing has topped that till during the COVID-19. Also, the American state of mind, which monitoring the use of psychotropic medication, the psychiatric medication for depression and anxiety and insomnia, actually they have found that there is a tremendous increase in use of psychotropic medication during from mid of February till mid of March. At the top of this increase was the anti-anxiety medication, the benzodiazepine, followed by, I think, depression and insomnia. The total increase was about 12%. What does it mean? What does it mean? It means that there is a tremendous mental effect of the COVID-19 pandemic. But when you talk about anxiety, what do you mean by that? Actually, it is a diffuse, unpleasant, and vague sense of apprehension and uncertainty. When we said uncertainty, we have seen a lot of uncertainty about COVID-19 pandemic. The starting time, out which time it will be end, regarding the vaccine, regarding the reinfection, we have a lot of uncertainty. The anxiety usually is excessive and persistent in nature and easily triggered by stimulus or by any stressors. And sometimes, actually, usually, the person who has anxiety has, he realized that the anxiety, apprehension, worries that he has is out of proportion to the actual danger. And when he tries to reassure himself by rational reassurance, he finds difficult. The anxiety disorder, it is the commonest type of the psychiatric disorder. It's about 25% the lifetime prevalence, and usually it is more common in female. Now, how can we differentiate between the normal anxiety that prompts our mind to think, that motivates us to take action, to take precaution, to prevent ourselves from infection, from any danger, from any threat, and from the abnormal anxiety or pathological anxiety? If the anxiety started to affect your function at the different levels of your life, at your work, at your social life, at your even self-hygiene, self-care, if any of those started to be affected and your performance started to decrease comparing to your previous performance, it means that you are within the circle of pathological anxiety, that you have to take care about yourself. You have to find a solution for this anxiety to not destruct your performance and destruct your productivity. The anxiety symptoms can be grouped into different groups: the physiological symptoms, the cognitive symptoms, and behavioral symptoms. And usually the cognitive or psychological symptoms is easy to withdraw the attention of the patient or the person himself, because it will affect his mind, and the others around him will be affected. The cognitive symptoms like apprehension, like excessive thinking, fearfulness, irritability, distractibility, having difficulty to focus on his work, sometimes even panic attacks, flashbacks. And the physiological symptoms, either autonomic symptoms like palpitation, like hyperventilation, or sometimes like dry mouth, chest tightness, sleep disturbance, sweating, or behavioral symptoms, being disengaged from the society, being aggressive to your colleagues, being aggressive towards your family at home, or avoiding being in your working team, being avoidant from your society. So this is the symptoms that we can see in anxious patients. Do we need to talk about it? Actually, there was some studies that recently published about the anxiety. Now, I want you to zoom out and to focus more on the healthcare workers or health practitioners. There is some studies. Those studies have been done in China, Singapore, and USA. It was assessing the mental health and psychological distress among healthcare workers. It found the range was between 20 and 44.6. Can you imagine that about close to the 50% of the health workers, they have an anxiety? It means that we have a big number actually of health workers complaining from an anxiety. And compared with non-medical health workers, medical health workers had higher prevalence of insomnia, depression, somatization, and obsessive compulsive symptoms. The problem is not just having psychological distress or an anxiety. The problem also, most health professionals working in isolation units and hospitals, they don't receive any training regarding providing mental health care. And they found that the early psychological intervention targeting this vulnerable group may be beneficial. If you are anxious, it means that you are not able to focus at your work. It means that you are not cooperative within the teamwork. It means that you are rigid to change your shift to give your colleague a time to have a rest. So early intervention or psychological intervention, it is very important to improve the quality of work, to improve the quality of life. Actually, they have found that the factors that leading to the psychological distress, this is an anxiety, this is a study published in UK. After reviewing the contributing factors for an anxiety, they came with about 8 factors. The first one, the emotional and physical burden or strain that come from increasing or growing number of actually acutely ill patients of all ages who have the potential to deteriorate rapidly. The other one, it was about caring for co-workers. When you care a patient that you don't know him, you will be fair with him. It is easy to deal with him like any other patient. But when you are caring someone who was just a few days ago, he was working with you, it will put a lot of emotions and a lot of physical strain to take care of him. The other problem, it was related to the shortage of personal protective equipment that intensified fears of coronavirus. Also, it was concerned about, which is very important in Saudi community, because we are, our community is put a lot of concern about the families. So concerns about infecting family members. And as you know, the Saudi community, they have usually extended families. So usually the healthcare worker in Saudi Arabia, he is very concerned about infecting his family members. Also, the shortage of ventilators and other crucial medical equipment, it was one of the factors that promote the anxiety symptoms. Anxiety about assuming new or unfamiliar clinical rules that will increase the uncertainty about the COVID-19 virus. The other thing, the limited access to mental services for managing depression and anxiety. As we said before, the problem that although the healthcare workers have high risk to have anxiety, the hospitals in general, it's not well equipped with well-being centers. The training how to control the anxiety symptoms, it's not that good for healthcare workers. Now let's come to practical points, how to maintain our mental wellness and how to reduce our anxiety during this pandemic. Actually, it is exceptional pandemic. It hasn't been happened in Saudi Arabia to both almost the whole community in quarantine. The first thing, you have to accept that some anxiety and fear is normal. If you have no anxiety, it means that you are abnormal. So please check yourself if you have no anxiety. So to have some anxiety, it is very important to promote your mental act, to motivate you to take action, to protect yourself. The other point, try to get the facts and keep yourself informed of accurate information from legitimate sources. Try to focus on the facts rather than on the ideas. The facts, for example, said that 80% of COVID-19 patients will have mild symptoms, and the fatality rate is very rare. So don't please focus on the fatality rate and forget this 80%. You have to focus more on the facts rather than on the ideas. The third point, please be balanced and keep things in perspective. You have to give balance between the time you spend at work and between the time you get rest. And you have to be balanced, either receiving the information and taking care of your patients and taking care of yourself, and try to take regular breaks while you are at work. Don't exhaust yourself by continue working for a long time without getting even short breaks, 15 minutes, 20 minutes, just to have a rest, to unplug your mind from anything related to the work. The fifth point is bring an intentional mindset to unplugging. Set aside some time to unplug from all electronics, including phones, tablets, computers, disconnect from the social media, limit watching the upsetting news. Sometimes even you need to schedule this time to make sure that you are unplugging from all of these upsetting sources of information. And during this time, try to do something fun and healthy for yourself instead, like either reading or doing exercise or anything that you like to do it. Getting adequate rest and sleep is important. If your sleep is disturbed, your next day will be disturbed. Engage in physical activity. Try to improving your physical activity aside from your work is very important to improve your wellness or your being. Stay in contact with your family and friends. Although we are in quarantine, you have to keep contact with your family, your friends, either by try to use the electronic devices to communicate with them. Don't say that I'm in quarantine, I have to keep myself isolated. No, you are isolated, okay, and you are in quarantine, but you have ability to communicate with your friends. Try to make your life very close to the routine that was before being in this pandemic time. Try to avoid, yes. Try to avoid unhelpful coping strategies like behavioral disengagement. Behavioral disengagement some people, instead of facing the stress or anxiety, he withdraw himself from this stressor. It is not helpful. You have to face this stress. You have to use good coping skills that we have talked about before. Try to some of the unhelpful coping strategies like self-destruction. And instead of getting, for example, some people, instead of getting naps or sleep, he keeps watching his mobile, he keeps following the bad news, which actually increase his anxiety. Also avoid self-blaming, avoid physical or verbal venting, aggressive venting, and also try to avoid substance use. Practice the relaxation techniques like meditation, like deep breath. Actually, we have two parts of the nervous system, the parasympathetic and sympathetic. During emergency time, the sympathetic nervous system is dominating. And by practicing relaxation technique, we give a chance to the parasympathetic system to dominate. So try to use deep breathing, relaxation techniques as much as you can. If any of those things you couldn't help yourself by those points, you can seek a professional help. And fortunately, we have a lot of volunteer groups providing mental support, either under umbrella of universities or under umbrella of Ministry of Health, or sometimes, or even the Saudi Commission for Health Science. As a conclusion, the healthcare workers are at risk of having an anxiety during COVID-19 pandemic, comparing to non-health care workers, comparing to the community. Applying stress management strategies is very helpful. And in case of those strategies couldn't help you, you have to call for your help, because your mental health is very important at this time to help yourself, to care yourself, and also to care your patient. So call for help. And I said we have a lot of volunteer groups. This is probably one of the services that's provided by Saudi Commission for Health Specialties, DAIM. They providing a free service to support the mental health of care workers. And thank you so much.
Thank you, Dr. Saleh. Very informative talk, and definitely a lot of advice for the help in the case of any psychological depressions or stress. Let me just go back to Dr. Muna, because I have a question and it was a little bit interrupted. Then I will come back to Dr. Saleh. Doctor, there is still the questions of being, when I can consider myself as cured, even if my immune system, and Elisa has shown some not effective or high titer of antibodies in my system. So the question is, again, when I consider myself cured, and how long it will be, how long I will be consider myself immune?
Cured after your resolution of your symptoms, usually after 3 to 4 days of symptoms free, we consider the person is cured, especially if his PCR test, the nasopharyngeal swab, which counts the live virus, is negative. And usually the initial protocol was to do twice, like on day 13 and 14 from resolution, but now it's only done once, the new recommendation. So if it's negative, then you're cured from this. Do you consider yourself cured? This is a hard question to answer. As I mentioned, usually the antibodies are formed within 2 to 3 weeks, or sometimes within a week from the onset of the symptoms and having a reaction. But it's hard to say for how long. Is it weeks, or it's months, or it's years?
Just let me just interfere. Today we have seen an announcement from the MOH regarding the time يعني it was before the results after being negative. You have to wait for the quarantine for at least 14 days. Now it has been shortened to 1 week. Why this happened? Can you explain to us why it was 2 weeks and now it's 1 week?
Because initially, when the pandemic started, the recommendation was because the first country that started was China, so we were following the recommendation from there. Once we started seeing cases here, we started seeing that the restrictions are shorter and they're turning negative faster than 14 days. So 14 days is not for everyone, and some of them last longer than 14 days. And the other most important thing is to empty the hospital beds and the dorms, because it's already full. If you keep every single person who has mild symptoms for 14 days till they have a negative swab, very hard. So you do it at day 7, and if it's negative, then that's it. He can be
So it is
discharged.
a more economical factors than
Yeah.
really a medical factor.
Yes, yeah,
Yeah.
because we found that there is no point of just wasting the resources and beds for that reason.
Understood. So I go back now to Dr. Saleh. Dr. Saleh, the question I'm receiving here, why do you think is this abuse of the anti-depressive or antipsychotic medications? Is it the isolations, the outlook, or is it the fearness of the media, or is it the reasons that there is uncertainty for the future, that the people are taking now this medication? What is really the reason for it?
Well, actually, it is multiple reasons. One of them is being in quarantine. One of them being losing their jobs. One of them being the fear of getting the infection. One of them also the uncertainty about this pandemic, at which time it's going to be end, the economic problems. Also, another point, like the change of the lifestyles. At a time or at a point, they put themselves in a new environment that is out of their routine. All of those things increase the level of anxiety and also depression, that leading to a surge in seeking for mental health. And the problem that some of the people, they might misuse benzodiazepine medications, which actually will not help them to get out of those problem. Actually, it will increase the risk of their addiction. It will just mask the symptoms, but it will not help them to get out. Once it ends, once the effect of those medication ends, it means the symptoms will come back. So instead of that, you have to apply some of stress management techniques. If it's not helpful, you can seek for professional help. They can start you on other medication that doesn't put you on a risk of addiction.
I have my personal questions.
Yes.
I am suffering now from loss of days. Personally, I wake. I'm watching this on myself, and I'm addressing, because now I see a professional that I can ask. I am watching myself that I don't know whether it is Monday or Tuesday or Wednesday, because every day it's becoming the same. And I ask my wife, what is today? She said, I don't know, because yesterday is the same day like today. And this caused me personally some disorientations. What I have, if it is Monday, do I have some appointment? No, I don't have. What is this problem? What this happened?
Well, actually, it is expected. If you change your routine to another routine, which is totally different from your previous lifestyle, you will have like those feelings. The best thing to get out from this feeling is to try to be within the same routine that you were having before, or at least to be close to that routine. For example, if you
I cannot. Yani my brother is a military man, and he is following rules like a military, and he is locking himself at home since the day one until today. He said, I will not go out of the house until the government allows me. And this happened to a lot of people in my relatives in my area. I'm happy that being a physician, I can go out because I have the permission. But these are situations that we don't know how to deal with it. So your advice is, what is this, your advice in these terms?
Well, this is my advice. Try to keep your routine as much as you can. What I mean by my routine, like your meetings usually at Monday, okay, try to keep your meetings at Monday. Don't distribute your meetings to the whole weekdays. The other thing, if you have, for example, a family meeting during the weekend, keep the weekend for your family meeting. If you have, try to design your schedule very close to your previous schedule. The other thing, using of the common basic things reviewing the calendars, the common basic things. It's actually very close to some patients when they put them on a hospital in a locked room, ICU, for example, patients, they become disoriented about the time, about which day to day is, which time now is. Just you can remind yourself either by reading, either by watching TV, or either by scheduling your time very close to the time that you were having before.
I just want to mention one, يعني في آية في القرآن يعني ألا بذكر الله تطمئن القلوب ويا أيها الذين آمنوا استعينوا بالصبر والصلاة إن الله مع الصابرين. يعني these are advices from the verse of Quran that praying and worshiping God in these pandemic situation can help a lot of can stabilize, let's say, the psychometry of the human. I have still few minutes to go. I have one more question for Dr. Mona. One more question, please. The question came to me regarding immunity, because you have said in your talk that, particularly in this study of the lady in Canada, she has been reinfected again, and we don't know whether it is the immunity system, whether it is the habit. My question, or the question I have received is it food habit? Is it the type of medications that I'm receiving, or the way of life that can increase my immune system? Because we have seen on the social media a lot of junk telling people, if you eat this or that or this, your immune system is better, and so on. What is your answer to this question, Doctor?
The thing is, having a healthy lifestyle in general is the key. Not only because of the COVID infection in general, because the most prone people to have the disease or to get the complication actually from this disease are people who have cardiovascular disease, who have lung conditions, who have diabetes. So and those people didn't reach that thing unless they have unhealthy life from before. If they were protective and healthy, they wouldn't reach those comorbidities. So that's one of the things, but there is no specific food per se or specific diet that you should follow to be like, I can't tell you be vegetarian or don't eat whatever. No, everything balanced and healthy and not like junk food or whatever will help you over the long run during this COVID or during any other disease in general.
Well, this COVID spoiled all our habits with the Netflix and the junk food during that. Most of people they gain weight.
Netflix, okay, but not junk food.
Okay. Now, just my last question also to Dr. Saleh. You have talked about the healthcare providers and the healthcare workers. And what I see in our hospitals, I will come back to this. And also you have talked about the public. More on the healthcare providers, because we are much stressed under these situations. And I have seen colleagues that were really depressed because they have been isolated from, even in the hospital, when they have contact with the COVID patients, they are not allowed to even greet us, or just from far away. We don't see them. We have the hospital split in two parts. One is the isolation COVID positive patients, and the other one are the other patients. But these people are under stress. They don't come to somebody to give them these advices, what you have said. Now, from practical point of view, how can we advise our colleagues who are really at the first front? We have many fronts. At the first front, you don't think that something has to be or happen to these people, that they are at the front, and we should give them some, not only advice, but only practical advice?
Well, actually, it is expected for those people to have some sort of anxiety or even depression. So
even, I just interrupt you. I have some colleagues, they have been told by their family, don't come back to home, stay at the hospital. عشان لا تعدينا بس.
Yeah, this is one of the stresses that they might have it. The practical point, beside the things that I said, they have to keep healthy, like healthy food, physical practice or physical exercise. It's very important. If they have a gym, for example, at the hospital, they have to go there to spend some of their time there. They have to have like regular communication with the others that they love, for example, their family or their friends. The other point, don't, for example, this is for the managers or for the leaders, don't allow them to work for a long time. Try to advise them to take a rest. Try to distribute the healthcare worker in homogeneous group. Don't put the experts, for example, in one group and non-expert in one group. Try to put homogeneous, because if someone doesn't have good experience and he found himself working in an area that is very stressful, it's difficult for him. So try to distribute them in homogeneous group, and also try to give them be more flexible regarding their shifts. Don't allow them to work, for example, continuously at night shift or during the day shift. Try to change the shift from time to time, just to give them a time to have a look at themselves, to take time with their family. It's not good for example, during the Ramadan time, most of the families are awake at night. If he is working during the day and sleeping at night, it means that he will not get a chance to talk to his family. So try to give them more flexibility in their shift.
Okay, thank you very much. Thank you. Now I'm just coming to the end of our webinar sessions. I would like to thank Dr. Mona Al-Faris, consultant of internal medicine and infection control at King Abdulaziz University, and Dr. Saleh Al-Ghamdi, also consultant in psychiatry at Jamiat Al-Imam bin Mohammed bin Saud Al-Islamiyya. You have been really give us informative informations, a lot of practical advice, and personally, inside I am more relaxed. Also, my anxiety has been pushed down now, more or less. I hope the others participants have really gained information from this. Again, thank you very much, and I wish you a pleasant night. كل عام وانتم بخير. Thank you very much. Thank you, Dr. Mona. Thank you, Dr. Saleh. شكرا.
Thank you so much. Thank you.
جزاك الله خير دكتور خالد. جزاكم الله خير دكاترة العلم.
شكرا.
شكرا. مع السلامة. شكرا.